Are you just starting out in phlebotomy? Learning the right techniques and tools is crucial for a successful career in this field. In this video, we'll explore key techniques and best practices every beginner should know. First, let's talk about the foundation of phlebotomy, blood collection. This is more than just drawing blood, it's about precision, patience, and care for the patient. Always begin by thoroughly washing your hands and wearing gloves to maintain hygiene. Patient comfort is key. A calm and confident approach will help put your patient at ease. Next, always confirm the patient's identity by asking for their full name and date of birth. This ensures the right patient gets the right test. Match this information to the test requisition form. Once you've confirmed the patient's identity, it's time to choose the right equipment. You'll be using essential tools like the tourniquet, sterile needles, and collection tubes. Let's start with the tourniquet. Place it around the patient's upper arm, about 3–4 inches above the site where you'll draw blood. Make sure it's tight enough to slow venous blood flow but not too tight to cause discomfort. Now, palpate the vein to find the best site. The median cubital vein, located in the antecubital fossa, is usually the go-to for most blood draws. It's prominent and less likely to roll. When you've located the vein, disinfect the site thoroughly using an alcohol swab in a circular motion. This step reduces the risk of infection. Select the appropriate needle. For most adult patients, a 21-gauge needle works well. Hold the needle at a 15–30 degree angle, bevel up, and insert it smoothly into the vein. Once you see a flash of blood in the hub, you know you've successfully accessed the vein. Attach the collection tube to begin drawing blood. Now, gently release the tourniquet and ask the patient to relax their hand. After filling the required tubes, remove the needle swiftly and apply pressure to the puncture site with a clean gauze pad. Finally, label the tubes with the patient's information immediately to avoid mix-ups. Always double-check your labels. This is just the beginning of your journey into phlebotomy. In the next part, we'll dive into common challenges new phlebotomists face and how to overcome them. Stay with us to keep learning more essential skills. Overcoming challenges and patient interaction. As a new phlebotomist, you're bound to encounter some challenges. Let's explore a few common ones and how to overcome them. One of the biggest hurdles for beginners is locating a suitable vein. It can be tricky, especially with patients who have small or deep veins. In these situations, patience is key. Take your time to feel around and find the best spot. You can also ask the patient if they have a preferred vein based on previous draws. Hydrating patients before the procedure helps make veins more visible. Sometimes, patients may feel nervous or anxious about having their blood drawn. It's important to reassure them. Start by explaining each step of the procedure in simple terms. Tell them how long the process will take and that they can expect only minor discomfort. This helps to build trust and ease any fears. In some cases, you may come across a rolling vein, a vein that moves or shifts as you try to insert the needle. To deal with this, anchor the vein properly. Use your thumb to apply pressure just below the insertion point to keep the vein steady. Then, quickly and confidently insert the needle to prevent it from rolling. Let's talk about managing needle phobia. Some patients may have an intense fear of needles, which can make the experience more stressful. In these cases, try engaging the patient in conversation to distract them. Focus on their breathing, and encourage slow, deep breaths to help them relax. Use words like pressure instead of pain when describing the sensation they might feel. If a patient feels faint or dizzy during the procedure, stop immediately. Make sure they're seated comfortably with their head between their knees, and offer them water. It's crucial to remain calm and professional, as your demeanor will affect how the patient responds to the situation. There may also be instances when the first needle insertion doesn't go as planned. Don't panic. If you miss the vein, remain calm and explain to the patient that you will try again, possibly using a different site. Remember, confidence and professionalism go a long way in maintaining patient trust. Being prepared for these challenges will make you a more effective and confident phlebotomist. And remember, every patient is unique, so remain adaptable in your approach. Advanced techniques, special populations, and conclusion. Now that you've learned the basics, let's move on to advanced techniques. These are especially useful when working with more challenging patients, such as pediatric or elderly individuals. Starting with pediatric patients, children can often be frightened by the idea of getting their blood drawn. As a phlebotomist, it's important to be gentle and use calming language. Before starting the procedure, take a few moments to talk to the child and explain what's going to happen. Use phrases like, "a little pinch," to describe the sensation. Always have a parent or guardian present to offer comfort. For pediatric blood draws, it's best to use a butterfly needle. These needles are smaller, making the procedure less painful and easier to control. Be sure to stabilize the child's arm and work swiftly but carefully. Sometimes, a small reward or sticker after the procedure can help create a more positive experience for the child. Next, let's look at elderly patients. With age, veins can become thinner, more fragile, and difficult to locate. Elderly patients may also have conditions like arthritis, making it harder for them to extend their arms fully. In these cases, take extra time to assess the veins and choose the best site for the blood draw. Again, a butterfly needle may be the best option for elderly patients, as it causes less trauma to delicate veins. Additionally, be cautious when applying the tourniquet to avoid bruising the skin, and make sure to release it as soon as the blood begins flowing. Patience and gentleness are critical when working with older adults. For patients with more complex medical conditions, such as those on anticoagulants or with a history of difficult blood draws, it's important to be extra careful and precise. Always consult with the patient to see if they have a preferred vein or if their doctor has given specific instructions. In these cases, following protocol is crucial to ensure patient safety. Now that we've covered a variety of patient types and challenges, let's talk about maintaining professionalism in every situation. As a phlebotomist, you are often one of the first points of contact for patients in a healthcare setting. Your professionalism, empathy, and attention to detail set the tone for the rest of their experience. Always maintain clear communication with your patients and colleagues. Being approachable and calm helps build trust and reduces anxiety for your patients. Remember, your skills are just as important as your ability to relate to those you care for. Before we conclude, let's review the key takeaways. Always prioritize patient comfort and safety. Practice proper technique and be prepared for challenges. Communicate clearly and confidently to build trust. Know how to handle special cases, like pediatric and elderly patients. Becoming a skilled phlebotomist takes practice and experience, but with these tips, you're well on your way to mastering the art of blood collection. Whether you're a phlebotomy student or a healthcare professional looking to refresh your skills, these foundational techniques will serve you throughout your career. Thank you for watching this video on Phlebotomy 101. If you found this information helpful, make sure to subscribe to our channel for more healthcare tips and tutorials. Hit the like button and share this video with fellow phlebotomists or anyone entering the medical field. Stay tuned for more in-depth guides and educational content. And remember, practice makes perfect, so keep honing your skills and becoming the best phlebotomist you can be.